Man,
Good morning, how are you today?
that's fine.
My name's Pat, I'm gonna be your nurse. Can you tell me your name and date of birth?
Kim, 12,
You
22.
can lie. Okay, and let's just check your name badge. And do you have any allergies that I need to know about?
No, I don't.
Okay, today I'm gonna do just a physical assessment of you. I'm going to listen to your lungs and your heart sounds and kind of check out your chest. So that's what so I'll be touching you and using my stethoscope, okay?
Okay.
All right, very good. So what I'm gonna have you do is, can you stand up for me first of all? Okay, and I'm just gonna look, and it looks to me like I notice her skin tone on her chest is pink and looks healthy. I don't see any paleness or any cyanosis, any discoloration that would cause me concern. I look at the shape of her chest cavity, and I see she looks like she is about twice as wide as she is front to back, which would be normal. So the shape of her thorax is as I would expect it with a 2-to-1 ratio. It looks symmetrical. Okay, can you turn? Okay, and now I'm going to ask you to just say 99 for me, okay?
99, 99, 99, 99.
So that I'm checking for fremitus, and I can feel the vibration all the way as I go down. It feels about even. It's a little bit more prominent up at the top, which is what I would expect, but I don't see anything that would indicate to me that she's got any kind of consolidation. Okay, what I'm going to have you do now, and ideally I would listen directly against skin. That's what you should always try to do. I just want you to say E for me.
E, 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 E.
Okay, and it sounded like E all the way down. It didn't sound like A, which would cause me concern if the sound had changed. Okay, I'm going to put my hands right here, and I want you to take a deep breath for me and relax. And what I can see is that my hands moved symmetrically, so it looked like her respiratory excursion was symmetrical, as I would expect. Okay, while I'm back here, I'm going to go ahead and listen to your lungs. I want you to take a nice deep breath through your mouth for me. Okay, go ahead and sit down. And I did notice that she had bronchofascicular sounds, which were a little bit harsher between the scapula and the spine. I could hear the distinction there. Otherwise, her sounds were symmetrical and clear. I didn't hear anything adventitious that would concern me. Let's see if I can find anything else here. Okay, so now if I come to the front, I'm going to go ahead and listen on the front as well. And once again, are you feeling dizzy at all?
No.
Okay, so once again, through your mouth, take some nice deep breaths. Can you raise your right arm for me? Take a nice deep breath through your mouth. Relax. And lift your left arm for me. Take a deep breath through your mouth. And relax. And again, I noticed the harsher sound of the bronchial sound over her trachea, and I can hear the bronchofascicular sounds here once again. And I can palpate her suprasternal notch, which is right there, and her manubrium, and then the angle of Louis. And if I go adjacent to that, I can find her second intercostal space. And I'll do the rest of that when I do cardiac. Then if you'll stand back up for me once again, and I can also palpate her costal angle, which is right here where the ribs come together in the front. And I can, once again, check excursion in the front. Take a nice deep breath for me. Okay, and relax. And I see that my hands move symmetrically, so I didn't see anything that would cause me concern there. You can sit down. I'm gonna go ahead and listen to your heart sounds. You just breathe normally for me at this point, okay?
Okay.
So now at this point, I will locate, once again, if I find the suprasternal notch, the manubrium, the angle of Lily, and I go adjacent to that, and find her second rib. She's got a pretty good divot. I'm not sure. Yeah, there's her rib, so we'll listen there. So I'm gonna listen to the aortic sound in her second intercostal space, right sternal border. And then I'm gonna go to the left sternal border and listen to the pulmonic sound. And then if I go to the third intercostal space, left sternal border, I'll listen to Erb's point. The fourth intercostal space. And for the sake of my faculty members' privacy, I'm not gonna keep invading your personal space. Because with women, sometimes it's easier if they're lying down, and then you can get the breast out of the way. So, but fourth intercostal space would be tricuspid, and then mid-clavicular line on the left side, fifth intercostal space, which is really gonna be right up against the bottom of the breast. You really have to lift the breast out of the way to hear it in a woman. And remember, when you lift a female breast, if they can't do it themselves, use the back of your hand, don't cup your hand. It feels less invasive that way. And then that's where you would listen to the mitral sound, and you would do an apical pulse for a full minute. That is part of your CPE, so you do listen apically for a full minute and count that apical pulse.
So wait, you said to the left, second intercostal, then to the left is the aortic?
No, right is aortic. Remember, all, start on the right side. All patients enjoy taking meds. That's how I do it. I use acronyms for lots of things in healthcare. It really does. It can help you remember. It doesn't have to, and if you've got a better sentence that you remember, that's fine. I mean, I've still got some from back when I was in PT school that I still use for myself to remember things. It's just, as long as it means something to you, that's all that matters.
And then what is the next one? Could you just go over it
Sure.
again?
Aortic is on the right,
Okay.
second intercostal space. Pulmonic is on the left. Erb's point on the left, third intercostal space. Tricuspid on the left, fourth intercostal space, and they're right at the sternal border. That's why I'm not saying that over again. So it's right sternal border and then left sternal border all three times. And then left midclavicular line, fifth intercostal space is mitral or apical.
Can I feel that?
In our
Left
CPE, we don't have a
midclavicular.
third intercostal space. It goes 2, 2, 4, and 5.
You have Erb's, don't you? You have Erb's pointing on there.
Does it?
On your CPE board?
Yeah.
Is it Erb's point listed?
Aortic, pulmonary, yeah.
Under cardiovascular assessment, it's in the cardiovascular. You're looking at the health assessment, Evan.
Okay.
And remember, there are a few differences between that full health assessment packet
Okay.
and the CPE form. And not to try to confuse you, but, the physical assessment packet has some stuff on there we want you to know. But as it's turned out, the CPE, they've added some things to the CPE that we didn't used to teach in 155, and Erb's point's one of them. So Erb's
Okay.
point